The United States surpassed China and Italy on Thursday and now has the most coronavirus cases in the world with around 104,000. This is today, Friday, March 27th, and on it, obviously those numbers would be a lot higher if we had adequate testing here in the United States and if we had engaged in earlier testing. So again, the U.S. has about 104,000 cases, Italy about 86,000, and China not adding a whole lot of cases, and they have about 81,000. There's close to 600 cases of the coronavirus or the COVID-19 virus worldwide, with around 27,000 deaths, and about 5% of people who contract this are in or have been in serious or critical condition at some point. So, I mean, that's pretty high when you look at it. And the kind of narrative that has been going around is that, it only affects old people or people with compromised immune systems, things like that. But I've been seeing on social media and reading some stories about young people who people in their 30s, 40s that seem to be pretty healthy, didn't have any underlying conditions or compromised immune systems or anything like that, and they catch this and have a really hard time, and sometimes it ends up being lethal even for them. I read a story just today about 17-year-old teenager in California who went to urgent care with symptoms of it, was turned away, told to go to a public hospital because they didn't have insurance. And as they were driving to this public hospital, they ended up having a heart attack, dying 6 hours later. It was later determined it was from the coronavirus. And he was like this healthy 17-year-old person who was fine like the Friday before, and then they ended up just dying from it. So, I mean, it's very serious. And, so what the question is obviously, why is this spreading so rapidly in the U.S.? What are the reasons for that? Maybe what are some things, public health officials or people, within the Trump administration, CDC or whatnot, what could they do going forward to try to slow down the spread of this, to flatten the curve, as a lot of these public health officials are always talking about. So, one of the things, as Jeffrey Sachs pointed out in this Common Dreams article, is obviously that, the United States is basically the only developed or so-called industrialized country in the world that doesn't have universal health care, that doesn't guarantee health care to every citizen in the U.S., which is obviously the case. We have a horrible for-profit healthcare system that is more concerned with protecting, the profits of the health insurance companies as well as the pharmaceutical industry than they really are with taking care of people and getting them better. They're just seen as, as dollar signs, basically. So that's obviously a huge problem for a lot of reasons. So just like the story I just talked about that teenager in California, if we had a universal healthcare system, he would have been able to get treated there potentially, and then he could still be alive. There's somebody else who got the coronavirus somewhere in the U.S. I don't remember where they live, but they ended up getting treated for it. They either had, really crappy insurance or no insurance. They ended up with a $35,000 bill because they were just unlucky enough to come down with the coronavirus. So, I mean, having universal health care where the testing and the treatment for the coronavirus was just automatically guaranteed to be free at the point of service would have been hugely beneficial to stop the spread of this, as well as, the fact that all these people are getting laid off from their jobs. 3.3 million last week, record-breaking numbers. Probably see the same from this week's unemployment numbers too, unfortunately, just because of just how completely upside down our economy is right now in a really hugely negative way. And then all those people don't have health care anymore. How they're either going to have to, take on a huge amount of debt, or they can maybe, if their state allows them to get on to, Obamacare or whatever. So there's so many things related to having universal health care so everybody is covered when a fucking pandemic happens. People can actually get the care that they need. And these, for-profit health insurance companies, the hospitals, all that stuff would actually be run for the good of the public, for a healthy and well-functioning populace, and not just to, again, pad the earnings of these for-profit health insurance companies and the pharmaceutical industry. So that's one that's huge. And don't believe anybody that says not having universal health care would not help during a pandemic. They are either ignorant of the facts, or they are shills for the health insurance and pharmaceutical industry. And then, so obviously it's been hugely mismanaged from the start by Trump for political reasons. He was made aware of this back in, I believe it was I'm pretty sure it was late January, by the head of Health and Human Services, Alex Azar, something like that, informed Trump then, said it, this could be a really big deal. We should probably start looking at it, ways to address it. It's going to get really serious. Trump pushed it off. He didn't want to get more people tested. He didn't want to take it seriously because he thought if the test numbers went up, then it would hurt his re-election chances. So he played it off as not being a big deal for as long as he could. And then when he started to see the economy tanking, that's when he got worried and started to implement some of these economic measures, bailing out of Wall Street, this, crappy stimulus that was just passed, things like that. And then let's also talk about the fact that he hasn't used basically at all the Defense Production Act to compel all of these big corporations that, could be producing the ventilators, the face masks, the gloves, the hospital gowns, all of these different, protective gear that these frontline healthcare workers and others, in these really important sectors of the U.S., so they're able to actually do their jobs safely while saving people's lives, in the case for nurses and doctors and healthcare workers. I mean, there's literally a hospital in New York City, I forgot which one, but there's a photo of it, maybe Mount Sinai Hospital, I could be wrong, I think that's maybe California, but anyways, these healthcare workers are literally having to wear trash bags because they did not have the adequate protective supplies. I mean, it is fucking ridiculous, and Trump has been dragging his feet on that because these corporations and the Chamber of Commerce was pushing him to not use this, or to delay using it, to really not take advantage of it, because they didn't want their business to be interrupted. They wanted to make sure they would still be able to, profit off of this, economic crisis that we're experiencing. So that's, part of it. Trump not using the Defense Production Act to, again, he was saying he didn't want to nationalize them by using this, and that's not what it does. It basically just says the government would be, the first buyer of any type of supplies from these corporations, so they would have to fulfill a government order before they could fill orders for, private industry or private individuals. So, obviously that makes a lot of sense in a crisis, in a pandemic where hospitals are, lacking these really important things like ventilators and proper protective gear. It would have made complete and total sense for Trump to employ that, a couple of months ago, so these people wouldn't have to be using the same face mask all day, so they wouldn't have to be wearing garbage bags, so people wouldn't have to be sharing ventilators at hospitals in New York. All of these things obviously was a huge failing on Donald Trump's part, and he was just wanting to protect, big business. And then we have the fact that Donald Trump dismantled the National Security Pandemic Unit in 2018. That would have been kind of important. The member of the National Security Council, who was a pandemic expert, Trump got rid of that. Probably would have been helpful to have that pandemic expert during a fucking pandemic, obviously. And then Trump also slashed the CDC's epidemic control teams in 39 countries. And guess what? One of those 39 countries was China. They would have been there. They could have been able to monitor this from the start. They could have relayed this to the CDC, the Trump administration, these other pandemic experts, and then we could have implemented proper controls. 2 months ago, so it wouldn't got to the point right now where we have 104,000 people infected with it, and it's going to keep spreading because again, there's been no type of coordinated effort from the federal government to implement some type of you know countrywide lockdown or shelter in place order. It's been all left up to local and state governments, and luckily, some of them have been taking it very seriously, like our governor and local officials here in Washington State, California, New York seems like it's doing okay. Right now, but it's just not the case across the board. And when you're lacking any type of leadership from the federal government, from the president, from Donald Trump on this issue, it creates a lot of confusion. And then now, we have Trump saying that he wants churches to be packed on Easter, which is only a couple weekends away, basically 14, 15 days, something like that, and how he wants people to return to work. This is again during a pandemic where this coronavirus is still spreading, and this is, again, a really important time where people need to be able to shelter in place, stay home, self-isolate, quarantine, stay away from other people. Unless you're in one of those important sectors, we need to make sure everybody can stay home as much as they can. And obviously, the government needs to provide UBI, healthcare, rent and mortgage freeze, expanded food assistance, canceling student loan debt, those type of things, obviously. But, again, there needs to be a coordinated effort from the executive branch during a pandemic that actually is worried about people's health and not their economic bottom line. Because again, I think one of the reasons Trump is wanting, to get people back to work so fast is because his hotels, his investments are losing, a lot of money during this time. But again, sending people back to work in the middle of a pandemic is not going to make anything better. It's going to spread it. The economy is going to tank even further. What would make sense, obviously, from a public health as well as an ethical, moral perspective, would have some real strong leadership from the president to tell people, this is a pandemic, this is really seriously, we're really concerned about people's health. We can pause the economy. It's just money. It's not a big fucking deal. What matters is your health and well-being. And, the U.S. government's got your back. We're going to give you $2,000 a month to every person until this pandemic's over. We're going to have rent and mortgage freezes. We're going to help small business. We're going to cancel student loan debt. We're going to implement Medicare for all. We're going to expand the CDC. We're going to nationalize these hospitals, and we're going to use the Defense Production Act, and we're going to reinstall these pandemic experts, etc. That's what a sane and rational and moral response obviously would have been from the Trump administration. And of course, Trump being the just supreme narcissist and just total buffoon and idiot that he is, did the complete opposite, and again, to really disastrous consequences. That's why, in part, with some of the other reasons I outlined, is why the U.S. has the highest amount of coronavirus cases in the world, and I think that's unfortunately going to continue unless Trump really changes course, but it doesn't seem like he's going to. So I mean, again, I'm just really thankful I live in a state currently where our state governor Jay Inslee and our public health officials, our schools are taking this really seriously. We're just being supposed to do shelter in place at this point, and if you're not in one of those essential fields, stay home. So I mean, this is why we need competent people in the White House. People like Bernie Sanders obviously would have handled this situation much better. But anyways, I hope you're able to stay safe, stay healthy, and stay sane as possible during these really just crazy and tumultuous times that we are currently living in. I would love to hear your thoughts in the comment sections down below, and please subscribe if you haven't already. Peace. Much love.